Do you want to know how to better care for your person with frontotemporal dementia? I've got 3 tips for you. Hi, I'm Joanna. I'm a dementia expert. I've been caring for people with dementia for 20 years and I make videos like this almost every day, so don't forget to follow me. So I want to talk about aggression, overstimulation, and communication with your person with frontotemporal dementia. So the first thing is people with frontotemporal dementia can easily become overstimulated with a lot of people in the house or a lot going on or doing anything with them before you explain what you're doing. And so please keep that in mind. Sometimes we've had our frontotemporal dementia people not be able to eat at the dinner table with everyone else because there was too much and they couldn't focus and they would get really frustrated. And usually they're going to give you a clue that they're going to become aggressive. Usually it's like a sigh or a facial expression. And so approach is a great way to handle that, but also medical marijuana gummies, indica kind, and a combination of Depakote and Seroquel can reduce the aggression significantly. Another thing that can really help with the overstimulation and the aggression is allowing them to walk. Typically, a lot of people with frontotemporal dementia are very physically able still since it's happening early in their ages. And sometimes they really like to pace. I've seen many people of ours that like to walk around the house and pace or walk outside, and that reduced their aggression and overstimulation significantly, almost to the point where anytime we saw them getting a little bit upset or a little overstimulated, we would take them out for a walk and it would almost reduce it 100%. The other thing I like to use a lot is music in frontotemporal dementia because their communication can be lacking, but they can still sing song lyrics because it's in a different part of the brain. And music can also help decrease that agitation or aggression. Last thing is that they struggle with communication because their temporal lobe is affected. And so they have aphasia, which means difficulty understanding words that you speak to them, as well as difficulty getting their words out. They often can only speak into 1 or 2 words, and they can answer yes or no questions, or if you give them 2 choices. But sometimes they can say yes for no and no for yes, so that can be a challenge. When you're speaking them, make sure you're speaking slowly, use minimal words, and then show them what you want them to do. So an example would be if you want them to take off their shirt, go take off your shirt and show them that you want them to do that. And that helps them to be able to understand. And really watch for facial expressions for them to see if they are understanding what you're saying or if they have a confused look on their face, and then try again. Hope that helps, and if you're interested in more tips and tricks on dementia, check out my website at www.mlfnd.org, where I have my Dementia 101 course.